somewhere along the way, dentistry stopped asking patients what they actually wanted and just started booking them in for the next thing. Crown, root canal, another crown, come back in 6 months. I've been practicing for nearly 25 years and I've watched that cycle destroy more confidence, more money, and more quality of life than almost any dental condition I have ever treated. This video is about what I believe instead. I'm Dr. Naresh Hirani. I hold a master's degree in clinical periodontics. It's the study of the bone and the gum tissue that essentially determines whether teeth survive long term. I've treated thousands of patients at Chalfont Dentist. Many of them arrive after years of work elsewhere that just didn't hold. What I'm about to share are things I believe strongly enough to have built my entire practice around. Belief 1, dentistry should be honest before it's anything else. The most common thing I hear from a new patient is some version of this: nobody's ever properly explained my options to me. They had crown after crown, they sat through appointment after appointment, and nobody ever said, here's what's actually happening in your mouth. Here are all your options, and here's my honest opinion about which one makes the most sense for the next 20 years. They were just booked in for the next thing, and that's just simply not good enough. A patient who doesn't fully understand their situation cannot make a real decision. They can only agree to whatever's placed in front of them. My job before anything clinical happens is to make sure that never happens in my chair. Every patient gets a clear explanation of what's going on, what their options are, and what I'd recommend if it were my own mouth. That last part matters the most. If I wouldn't recommend it to someone I care about, under no conditions I would recommend it to you. The most expensive thing in dentistry is a decision made without the full picture. And the full picture almost always starts with something most dental appointments never actually look at properly. Belief 2, fixing one tooth at a time is not a plan, it's a holding pattern. Dentistry tends to be reactive. Something breaks, you fix it, the patient leaves, you wait for the next thing to go. I understand why practices work that way. It's efficient, patients expect it, but it's not what creates stable, lasting outcomes. Your mouth's a system. The gums, the bone, the bite, every tooth working together. When something keeps failing, the cause is almost never the individual tooth. It's something running underneath that nobody has addressed. Gum disease, quietly dissolving bone. A bite, putting excessive forces on specific teeth year after year. Structural weaknesses that have been compounding silently for a long time. Treating one tooth at a time without identifying that pattern is not solving the problem, it's managing the decline. Every patient I take on gets the full picture, scans, photographs, a proper gum assessment, a bite analysis. We build a plan around where they want to be in 10 or 20 years, not around whichever tooth is causing the most trouble today. Reactive dentistry is the most expensive dentistry there is, and most patients are stuck in it without even knowing it has a name. And the part of the picture that gets missed the most often is also the part doing the most damage. Belief 3, gum disease is the real enemy, and most patients have never been properly checked for it. Gum disease is the leading cause of adult tooth loss, not cavities, not accidents, gum disease. I hold a master's degree specifically in this area, and the finding I see most consistently in complex cases is that active progressive gum disease has been present for years before anyone formally identified or treated it. Patients arrive with significant bone loss and tell me their previous dentist said their gums were fine. Not because that dentist was careless, because a visual check is not the same as a proper periodontal assessment. They're completely different things. And most patients have never had the second one. The bone that holds your teeth in place does not grow back on its own once it's gone. Every month of uncontrolled gum disease is permanent, silent loss. Catching it early keeps every option on the table open. Missing it for years takes options away one by one. You can have advanced gum disease right now with no pain, no bleeding, and no idea it's happening. Once the underlying disease is controlled, the conversation shifts to what to do about the damage it has already caused. And this is where I have the strongest position of all. If this is the most direct conversation about teeth you've heard in a while, this is what I publish every week. Hit subscribe so you get the next one. Belief 4. Dentures should be the last conversation, not the first one. I hear this constantly from patients who arrive for a second opinion. They were told their teeth were too far gone and a denture was the only option. Sometimes that conversation happened without a 3D scan, sometimes without a full gum assessment, sometimes in a 5-minute appointment at the end of a routine visit. And I strongly disagree with that approach. In 2026, the alternatives to a denture are far better than they've ever been. Full arch implant solutions, digital planning that lets us design the outcome before a single tooth is touched, fixed teeth that function and feel like the real thing. These are not experimental treatments. They're predictable, well documented, and they change lives in a way that a removable plate simply cannot. Most patients who were told dentures were their only option were never properly assessed for the alternative. That's not the patient's fault, but it's something they deserve to know. Dentures are not inherently wrong. For the right patient in the right situation, they're a valid choice, but they should be a considered choice, made with full information, not a default handed out because it's the simplest thing to offer. Most patients accept dentures not only because they're the best option, but because nobody showed them what else was possible. Getting to the right solution also means being honest about something the profession rarely says out aloud. Belief 5. Sometimes the right answer is to stop repairing and start again properly. There's a point in some patients' histories where continuing to repair is no longer in their interest. Every additional crown on a failing tooth removes more structure. Every retreatment of a root canal spends more of the bone that eventual implant will need. Every month, a tooth with no long-term future stays in the jaw. The case that follows it gets harder. At some point, the honest thing to say is, we need to stop patching this and build something that will actually last. I know that can feel like giving up. It's the exact opposite. It's the decision that finally gets someone off the treadmill of treatments that never quite hold. The patients I have seen make that call when it was the right call are the ones who come back and say they wish they'd done it sooner. Not because the treatment was easy, because the cycle finally stopped. Doing the right thing once will almost always cost less than years of doing the almost right thing repeatedly. But none of this matters if we miss the real point of why any of it matters in the first place. Belief 6. The goal is never just better teeth, it's a better life. Anita had been going through a cycle of failing root canals and cracking crowns for years. She came to see me and said, "Naresh, can you help me? I really don't like my teeth." It was an emotional moment just to say it. We made a plan. Full arch implants, top and bottom. When I fitted her teeth, she rushed to the bathroom before I could hand her the mirror. She came back in, a flood of tears. There were tears of happiness. She'd caught a glimpse of her new smile and was overwhelmed. And that moment stays with me. The teeth are the mechanism. The life is the point. Eating without thinking about it, smiling in photographs without catching yourself, stopping the daily background worry that failing teeth produce in people who have lived with them for years. I've been lucky enough to see that shift happen hundreds of times. It's why after 25 years, this work still feels worth doing. Healthy teeth are invisible. You don't think about them. The moment your teeth start taking up space in your daily thoughts is the moment something needs to change. That is what I believe. That is what this channel's built around. Every video I put out goes deeper into one part of that picture, whether it's understanding why dental work keeps failing, what gum disease is actually doing underneath the surface, or what real alternatives to dentures look like in 2026. If any of what I shared today resonates, the rest of the channel is worth your time. And if you're at the point where you want to talk about your own situation specifically, the link to book a consultation is below. I'd be glad to hear from you.